now for a few more best practices in the mid-cycle. As leaders, we are only as successful as our teams. And there are a few steps you can take to ensure you're recruiting and retaining top talent. As Ronnie mentioned, we actually start prior to employment. Implement a pre-hire skills assessment. This helps you to get the right person in the right role. Now, keep in mind, this isn't a test. It's an assessment to establish if the candidate has the necessary skills to be successful in the role. Now, each area of the mid-cycle has a different skill set and needs a different focus with pinpointing the more complex areas. You need a skills assessment for coding, for each of the different patient types, for your clinical documentation specialist, for your HIM team with chart analysis, and with your revenue integrity team, both with CDM management, as well as your charge audit team. Now, once team members are hired, spend time with them explaining expectations and policies and procedures. Don't just sit them down with the written documents or a written policy and procedure book. You need to make sure that they can repeat back some of the key messages. Find ways for the team members to know they're making a positive impact with consistent feedback, meaningful recognition, and targeted reward for high performance and engagement. Now, this is one you've heard quite a bit about today, and I'm really glad that you answered the polling question the way you did with our emphasis today on quality. But make sure you have a continuous quality program across all the mid-cycle functions. Oftentimes, we focus on quality reviews during the first few weeks of employment. However, it is critical for performance and for team member engagement to have an education and training plan with constant feedback on their performance. Have a dedicated audit staff for the more complex areas, with operational leaders being involved with the feedback and the ongoing results. Now, don't forget, the quality programs and performance monitoring should cover both your badged or employed team members as well as your vendors. Establish the appropriate cadence for monitoring and feedback. Now, some performance needs to be monitored constantly throughout the day, such as transcription turnaround times, while others can be monitored daily or weekly. That cadence is critical to ensuring performance. Now, as you heard from both Ronnie and I, technology can automate manual tasks to free up team member time in order to focus on more important tasks. It can also do some of the heavy lifting with providing detailed analysis and decision-making data. A few examples where we've discussed that technology can help streamline are the auto assignment of provider deficiencies in the medical record documentation. We discussed documentation templates to help with coding accuracy on specificity. Automated charge capture technology to find anomalies. The charge description master workflow, and a coding audit technology. Of course, there are many other technologies in the industry that we didn't cover today, such as computer-assisted coding and autonomous coding. Everyone is very familiar with these applications. However, keep in mind that even with the most advanced technology, you still need to establish the key components we discussed today. Now, moving on to the next slide, I'm going to share some additional tips. Healthcare organizations need to create a culture of continuous improvement. To help with this, put in place rewards and recognition for team members who submit improvement ideas. And as we've already discussed, given our ever-changing healthcare environment and all the associated risks, it is critical to create and maintain a culture that embraces change so you can adapt your mid-cycle accordingly. With all the opportunities that we've covered today to improve your mid-cycle, dependent upon where your organization is at with each area, we saw differing answers to our polling questions. So as we suspected, everybody is at a different part in their process. So it may sound overwhelming and or cost prohibitive. This is why we see so many healthcare organizations turning to a revenue cycle management partner like Conifer Health Solutions to provide either end-to-end revenue cycle services or point solutions specifically for the mid-cycle. So what are some of the key components to look for in the right partner? Specialized, best cost geographies with deep domain expertise, along with quality focused processes that can improve your performance and provide efficiencies while at the same time decreasing your cost. The right revenue cycle management partner will bring solutions that optimize your financial performance, improve your business outcomes, and elevate the healthcare experience. And with the challenges facing healthcare today, such as rising labor costs, staffing shortages, shifting payer mix, and margin pressures, just to name a few, that all create competing priorities, hospitals and physician practices need a partner that cares for your business the way you care for your patients.